Hey, hello everyone. Welcome to the Inspire by FVMA's panel discussion for veterinary professionals. So we're going to talk about the kind of the state of well-being with three great experts, three people, knee deep, elbow deep, neck deep, doing the hard work in the field, in this area. And I'm just like I took a minute and I'm like looking around at each of the squares and knowing how I know everyone, knowing the work that they're doing, and it's like I get a little, a little misty, a little verklempt, like thinking about like the energy that's in here. And so I just want to honor that they're all sharing their time with us tonight. And I'll start for an intro, who you are, what you do, and we'll go to my right, and that's Rebecca.
Thank you so much, Phil, for that warm welcome. Hi, everyone. My name is Rebecca Newman. I am a registered veterinary technician in the states of Colorado and North Carolina. I am also the full-time well-being coordinator for Appalachian State University. And that's the first, I think, full-time academic well-being professional.
And next, Andy.
Hello, everybody. My name is Andy Davison. I am a credentialed veterinary technician as well. And I'm also a positive change agent with Flourish Veterinary Consulting.
And last but not least, my friend Cody. Cody, also from Florida.
Yeah. Hey, everybody. Cody Waldrop. I'm certified veterinary practice manager. I've been in vet med 20 years. Started off as a kennel kid and worked in a variety of roles before I eventually got into practice management. Past several years, I've had the privilege of doing multi-site, multi-state operations. So I get to support a number of different teams across the country. Blessed to do what I get to do every day. Currently sit on the Veterinary Hospital Managers Association's board of directors. So going to do a lot of fun work there. And currently working with PetSmart Veterinary Services, supporting 23 practices across 10 states and Puerto Rico.
So, Cody, one of the things that I want to touch on, and then Rebecca, I also want to come back to you because we didn't get to talk about, how your walk in veterinary medicine as well. But Cody, not only were you a practice manager, but you've had almost every had your feet in almost every position in the hospital, as well as being in vet school, if I remember correctly.
Yeah. I did a brief stint in vet school. Wasn't for me. Got back into management. But yeah, no, obviously started off in the kennel, worked my way up as a vet assistant. I use the word technician loosely. I'm not licensed, but did spend a lot of time in patient care before I got into practice management. Have worked plenty of CSR shifts, so can definitely pull on a lot of experiences that I can share with my teams that I get to support every day.
Thanks, man. And Rebecca, too, before you got into your position as an administrator, what was your walk like in veterinary medicine?
So my walk was long, long and winding up to veterinary medicine. So I started out in thinking I was going to be a clinical psychologist working one-on-one with clients. And as I was going through my graduate studies, I experienced burnout. And so I decided after a long, hard road that I needed to focus on my own well-being in order to help others. Eventually, that path led to going back to school to become a veterinary technician. And I was at an age where I realized, you know what? I love helping humans, maybe even more than animals. So I went right into academia.
Fantastic. Like I just said that because I love hearing the stories of, like, we can look one line and see letters after our name or see this, but like what the journey was like what we bring, to the table, and the experiences that we've had that shaped where we are right now. And I think it's safe to say that for the four of us, like if we said, 20 years ago to I think we're all old enough to say 20 years ago, sorry. But like if we said, yeah, if we said, hey, by the way, you guys are y'all going to be very very instrumental in in working and well-being in the veterinary profession, I know 20 years ago, me would have had some 4-letter words to say to this old man. But yeah, I mean, it's just that the path that we've been on, to get here. And so with that, I want to kind of take that into our first question and say it's a tricky, but in one sentence, and you can absolutely expand on it. But how would you describe the current state of well-being, like where we're at right now? And we'll go in the same order. Rebecca.
The current state of well-being, I would have to look at my notes to keep it to one sentence, and I'm not going to do that.
You can expect you. There's no way to do it in just one, but yeah.
Phil, and I think just the fact that I'm included in this conversation today speaks volumes to the state of well-being in veterinary medicine. I work for a veterinary technology program, and I'm, I was hired to be in charge of well-being, and that is a full-time position. I'm able to survive and live my life doing that. And the fact that is a position that is seen as part of veterinary medicine, to me, says we're heading in a good direction. We're putting well-being boots on the ground into our educational system, and so that we can produce folks who hopefully have a lot of awareness and support moving forward.
And I just love that we're having those discussions like right off the bat. So good. Andy?
Yeah, no, that's incredible. The thing that came to me when I was thinking about this was it kind of played off a little bit of what you were saying, Phil. We've been around a while, right? And I mean, I've been in vet med over 20 years now. And the dynamic state of well-being in vet med has changed drastically in that time. We were not having these conversations when I was in tech school. We just weren't. Well-being wasn't a thing. Resilience wasn't a thing. Boundaries weren't a thing. It wasn't a thing. It was all about the clinical skills. And so I really think that reflects, like you said, Rebecca, it's a beautiful reflection on where we're headed in vet med, because we're having these conversations. And to me, that really signals growth within our profession and within this industry. And it's where well-being, it's not a whisper anymore, right? It's not something that you have to like quietly say to your bestie because you don't want anyone else to hear. We get to shout it from the rooftops, and we get to talk about it. And that is a beautiful place to be. And I love that. And so that's really what came up for me there.
Cody, what about you?
Yeah, it's funny, Andy. I wrote down the word growth as well. I definitely think that we are in a growth state. I mean, we have continued awareness, continued support initiatives that a lot of great people are working on that are fostering positive change for people currently in our roles and those that will hopefully be entering in vet med. So yeah, now I think that we're in a growth phase and headed in the right direction.
Awesome. Fantastic. Thank you. So next question is going to be for Rebecca. So from the academic viewpoint, from your perch, if you will, bird guy here too. Love horses, but I'll talk your ear off about my birds. So between Andy and I, we'll take up your whole day. What trends are you noticing in the mental health of your students, or what's coming up? And not just technician, not just our technician students, but other roles if you're having exposure to them. But what are you seeing as trends moving forward, or what are you seeing in practice and at work?
That's a great question. And I would say, gosh, that word growth comes to mind. I've seen students grow in their emotional intelligence capacity, their capacity to talk about mental health, surprise me with their awareness. I do see a continued concern with mental health in our college students. The students in our veterinary technology bachelor's program range from 18 years old to somewhere in their 60s. So it's really a very diverse group that we have. I have had the opportunity to, I'm on something called the early intervention team at App State. So I get to meet with undergrads from all different departments. And I would say, depression and anxiety are just across the board. They're super common. And motivation is another just big concern. There's a hard time for students to be motivated. And then when we dig into that, turns out that they are all working, most of them are working full-time jobs, very involved with family, and plus taking a full course load so that they can receive financial aid. So the trends are, I would say, they're concerning in some senses, and also inspiring in others. I'm seeing students maybe more grown up than I've seen them ever before.
Great insight. And I love that we've been talking about growth too. And I just share a quick story of we had an extern at our hospital. I think it was around the time of COVID, and so she was a third year student, kind of second semester, third year. And so I said, I told her, I was like, oh, I'm going, I'm going over to speak to the freshmen, doing talk, early on. And she's like, oh, that'll be great. She's like, that'd be great, for him to hear your message and this and that. And she goes, oh, I can't remember who it was, but we had this guy, like it was like right when I got there freshman year, and they came in and they were talking to us about the suicide risk and all the burnout and all this stuff, and it was so depressing and it was so miserable, and it was me. Like it was, and I realized like that, like, so we get so focused, or I mean, it's just like watching the news too, and I don't think anybody in this virtual room here would discount that concern, but it's also, do we give space for the beautiful things in veterinary medicine? And and you all said the growth that's there, and being able to impart that growth mindset, which is key for resilience. I know Andy just talked about that, and she teaches on that, and it's just giving them those tools as well, because it is hard. Like, I mean, nobody's going to say that vet med isn't challenging, but it doesn't mean that we have this fate that we're all going to go down this road. And so, and I know my own story, like that was really impactful for me to learn those tools. Andy, I'm gonna go to you and say, what are some of the strategies or the initiatives that you've seen that have really made a difference in well-being in clinical settings?
Mm. This was a fun question to think about, because when I thought about this question, my brain instantly went to, okay, well, what are the initiatives? Like listing them off and thinking about what they all are and all of the different things that clinics are implementing, whether it's like a big corporate led program to, leadership support, coaching opportunities, peer mentor programs, a therapy dog in the break room, like whatever that means. I was like, oh my goodness, my list, it got really long really quickly. And then I stopped and I thought, my list, it got really long really quickly. And I think that's the standout point for me, right? That's the thing that stands out about the initiatives. It's not any particular initiative. It's the fact that they're out there, and it's the fact that they're happening, and it's the fact that they're coming at you in all different ways. So is it a big corporate led program? Maybe. Is it a golden doodle in the break room? Maybe. And it's something, and it's an effort in a variety of ways to start to support the well-being of our profession and start the conversation and start to show vet med that it's safe to be a human in vet med, right? That's scary, right? Being human is scary. And knowing that we have a place to do that safely is so reassuring. And these initiatives that are showing up, all over the place throughout our industry are reiterating that it's okay to be human and that it's safe for you to be human here. And that is a strategy in and of itself that is promoting and supporting well-being in vet med.
That and just kind of piggybacking on that as well, Andy, and that just again, really, really great insight in the things that you're listing off is that, what's the what was it? The Teddy Roosevelt said, like the best thing you can do is make the best decision. The second best thing you can do is make the right decision. Second best thing you can do is make the wrong decision. But the worst thing you can do is don't do anything. And so that's one of those things is like, just even tiny is mighty, and Cody, in our well-being champions certification, we talk about that. It's just one small step forward is that we don't have to overturn everything. But if we just get that momentum going of that little thing that's got impact, maybe, and like Andy was saying, it might be that golden doodle. It might be, hey, when we have our meetings, we're all gonna put our cell phones away so that we're paying attention to one another and we're showing each other that we matter. We're showing each other that what you say, I'm listening to. Just starting with something as simple as that to a wholesale, well-being, plan where we've got a chief well-being officer. We've got this, and we've got, staged interventions and we're measuring, we're taking measurements and all those things. But yeah, just the initiative of let's do something, and let's do something small. And I think the other thing that's wonderful that I'm seeing, more evidence-based interventions and not saying, oh, we're going to do this one thing. Like everybody needs to do a gratitude list, or everybody needs to do this one thing, which is really cool. And it does work, but there's space for, hey, this might work for you. If not, we'll try this. And there's more space for shifting and grooving. Cody, VHMA, like what are some of the things, like specifically in your association? So how long have you been associated with that association?
Yeah, I've been a member since 2018, and then got elected to the board of directors in 2023.
Awesome. And what's cool too is I think 20 years ago we went. What are some of the things that your association is doing specifically around well-being for your members?
Yeah, absolutely. Yeah, we have great peer networking resources, also mentorship programs. We've held a lot of webinars to normalize conversations around stress, burnout, leadership fatigue. I think what stands out most for me is how BHMA fosters a sense of community among practice managers. Being a practice manager sometimes can feel isolated. So just simply having access to others in your role, I think speaks volumes, knowing that you're not alone, and can have a community to share experiences with and solutions is incredibly important.
Wow, love that. Rebecca, ABTE, what are you doing? What's going on specifically? Because I know you guys are doing quite a bit, but just in the continuum, of where the association has been, to where you are now, like what are you specifically doing for well-being?
Sure.
Like
so some of the, our focus right now is on our upcoming conference in August in Louisville. And it is a community. There's no other way to describe it, but just a wonderful community of educators. And our focus is three-pronged. It's leadership, mentorship, and innovation. And those we have focused on well-being in the past. I think sometimes people get tired of hearing the word well-being over and over again. I know I do at some, sometimes. So it's good to shift it up and remember that, well-being comes in so many different forms. So, the biggest one I can think of is communication, right?
Yeah.
Um, the research on effective communication and how it benefits veterinary medicine is, I don't think I need to share that with you all, but
Yeah.
I do share it with my students because it's essential for them to know. But at AVTE, we are focusing on, you know, on those areas, on doing, focusing on new faculty members. They are a group which I think similar to how technicians used to just get put into a position of leadership because they'd been at a clinic for so
Yep.
long, and maybe
Yeah.
occasionally that still happens. But similarly, faculty get thrown into teaching with often very
Yep.
little teaching experience. So we are looking at that as part of the kind of the whole, a pillar of the whole solution.
Uh, just sitting and listening to the and to the like one thing you said, I think all of us, the things you listed, and you're like, well, not specifically well-being, but we all know, like, leadership, 110%. Like, we all know the impact of leadership on on team level well-being and that leader's well-being. I love, Cody, that you mentioned that as a practice manager, it can, or as a leader in the practice, sometimes you can be surrounded by others and sometimes feel alone because you don't necessarily have somebody right there that you can be completely vulnerable with, or that you can offload some of this thing. And so it's great to have that board of directors, or that that team that you can get on the phone with and go, oh, I just had this thing happen and I just want to run something by you. I really love that you're doing that, Andy. And I apologize for not knowing. I know you're involved in a ton of stuff, but like from like an organizational, like association or organizational lens, if it's all the way back at University of Florida, great. But going forward, if there's what bigger organizations like that membership organizations are you with, that you've seen or that you're part of, that moving forward?
Yeah. There's so many, right? Like we could probably spend the rest of
Yeah.
the time talking about the
Yeah.
fantastic organizations that are out there supporting veterinary professionals. Some of the ones that I've been really lucky to be involved with are the equine related ones, right? Because I get excited about the horses and I
Yeah.
have a very special place in my heart for equine veterinary professionals. And I've been really lucky to be involved with some of the BI programs. They have a stable life initiative that really goes out and supports horse docs, horse professionals, technicians out in the field doing the thing. There have been a lot of other like corporate level support systems out there as far as, organizations that are out there doing for their people. When it comes to like associations, I am admittedly not super active member of AAEVT, which is the American Association of Equine Veterinary Technicians. But I do follow along with what's going on with them, and they're having the conversations too, right? Like, what do we need in order to thrive? What does that look like for us? It's different than some of the other facets of vet med. Okay, what do we do in order to get there? And so they have a lot of programs, they have a lot of conversations that are getting started, options, with their activities and events and conferences to really jump in and get with other people that get it, right? Because I think you guys have touched on this too with the practice manager. Equine technicians and equine veterinary professionals can be really lonely in the truck too. You're out there doing it, but you're driving around from farm to farm and you may have somebody else in the truck with you, you may not, but there's such value in being able to connect with others that not only get vet med, but like get your flavor of vet med. And so to be able to kind of find situations like that is really fantastic. And so I drift towards the horse ones because that is me. So
I love all of this. And I think about, just for me, like thinking about my experience as somebody in long-term recovery, is being able to talk to others who are walking through the same path with, on the path with a solution moving forward, is just, there's something about that. And we talk in the rooms about the power of one alcoholic helping another. And is the same thing with one practice manager helping another, one equine veterinary technician helping another. And there's just something about that trust and rapport, that's there as not only a human being, walking through here, but a set of common, experiences that makes it a little easier for us to, I think, open up and get vulnerable quicker. And, I just want to tip my hat. I mean, I'm biased, but the FVMA, we're doing the Inspire by FVMA program. And so that's a multi-tiered program that's, we like talking about me, we, and us, individual level, well-being and resilience, team level. We talk about psychological safety. We talk about leadership. We talk about communication, and organizational. We talk about psychosocial factors, like the things that we know that happen in an organization or in a veterinary hospital that can be deleterious to to our mental health. And the flip side is not just deleterious, but a lot of times when we do those things really well, those are the things that push joy, fulfillment, retention, or recruitment, all the things that we're looking for. And I'm really proud of the FVMA for doing this, but also there's just so many people doing really awesome things that, again, just wasn't there, 20 years ago. 20 years ago, like if somebody was talking about having an EAP, like that was, that was like light years ahead of, where everybody's at. And like, it's almost standard of practice now, for an organization to have access to it or that type of thing. So it's just really great seeing that. Okay. So we talked about some of the really great things that are happening, what's working well. So some of the challenges, because we do want to talk about that. We'll go backwards this time. We'll go Cody, Andy, Rebecca. What are some of the systemic barriers that you see to sustainable well-being in the profession, Cody?
Yeah, I think it's multifaceted, right? Kind of pulling from my, practice management mind, if you will, staffing challenges always seem to be at the forefront, right? Whether we're short staffed, and I think, financial pressures, right? Whether that's from a practice owner or a corporate group, bringing your practice to certain KPIs that they want to see, so I think that there's a multiple, things that tie into that. I think we talk about access to care for pets, but I think access to care for our team members as well. There are still practices out there that don't offer benefits, as crazy as that seems. So, sometimes something that hopefully should be obtainable, like just simply going to therapy, might not be attainable to a technician or a kennel assistant. So, I think that those will continue to be challenges that we'll need to navigate.
Thanks, Cody. Andy?
One of the more significant cultural barriers that I notice is often subtle, and it is that belief that we're in competition with one another. And this tends to show up, right, in a variety of ways, whether it's, somebody else has a successful case, somebody else has more or different letters behind their name, whether or not we can ask for help if we're not really sure how to place a central line in a 3-week-old kitten, right? Like that sort of competition that tends to bubble to the surface occasionally in our profession. I think that can be a barrier, and it can keep us from opening up, from being vulnerable, from asking for help, from connecting with one another, because we put our armor up because we don't want that other person to know that we also are not 100% comfortable putting a central line in a 3-week-old kitten. And so there is that kind of plays in a little bit that I think will contribute to some of the challenges that we feel. And it really reiterates a lot of the value that comes with connecting with one another, and that communication piece that I know this won't be the last time we talk about. Because if we can create that connection, right? If we can create effective communication, if we can start those conversations and remind each other that it is safe to be human here, we're going to let that guard down a little bit. That competition isn't going to be so important. That other person's success is going to be worth celebrating, and it's going to be valuable, and it's not going to in any way reflect on us, our successes or our failures. So a little bit of competition does tend to stand out to me.
And absolutely that insight, and it's one, it's one thing too when we get the opportunity to talk to veterinary students, it's just getting in that like what got you here, isn't really going to get you where you're at. Like now you cross the line, we're all on the same team. Like, it's like once you're in, like, forget, the old Yoda, you must unlearn what you have learned, and, but it's so true and where does it all come from? And I know Rebecca.
Oh, it's
Rebecca
that human brain of ours.
Yeah, it's that fear, that judgment, that negativity bias. Like, and what do they think? And then thinking everybody else has their shit together, and I'm like, I'm the one that's struggling, and again, that open and honest communication and being able to be vulnerable, it really opens up that connection, just like you said, Andy. Rebecca?
Gosh, um, I love I love what has just been shared, and Andy and Cody and Phil, um, because I met with a student today, and she works in clinic. She's also getting her working towards her bachelor's, and she'll sit for the VTNE. And she is she is playing tapes in her head about what her colleagues at work think of her. And I would be a zillionaire if, you know, for every time a student says that to me. Um, such such concern and care for their patients, and such concern and care for what other people think of them. Which, so, every, I would say, every intervention that I try to use is evidence based, just to bring that back to what Phil had mentioned earlier.
And I know I'm biased, but I know everybody in here has a similar background, and Cody going through it too. Is we know, like, that's the awesome thing about positive psychology. It's like, where did it come from? Very much a treating pathology, mindset, to all of a sudden in 1998, Martin Seligman says, the thing we all know is like, what if you know creating the good in life was just as important as treating the ills? Like, what if that was, had equal focus? And I love that we're going through that now, is that it's not just, I hear so much too about burnout prevention, and obviously, like, yes, that is important. And you know creating a workplace that's amazing. And I think of, and I say this just because I was in the room when it was said, but I had a technician say, during a meeting, it's like, I'm so grateful because, we come here to get away from the world, and it's like, that's the, like, if we could do that, like, it's just being intentional about creating that, that environment where we love to come. And then and I know everybody in this room is working towards that. And so along those lines, what I would say is, if you could, the old coaching question is if we could wave the magic wand, and we could change one thing, we'll just say one thing to improve well-being in the profession tomorrow, what would it be? And we're going to go Andy, Rebecca, Cody. Andy.
Oh, I get to go first. I feel like I've got the advantage here. My answer is not going to surprise anybody. And I'm excited because this will hopefully prompt a great conversation. But if I had a magic wand, I would ensure that every veterinary professional had the skills and the confidence to communicate effectively, with clarity, and with kindness. Because effective communication is the foundation for well-being. It's the foundation for all of the components that create well-being: psychological safety, curiosity, authenticity, vulnerability, all of those things, belonging, mattering, feeling like you matter and that the work that you're doing matters. All of that starts with effective communication. And my magic wand would absolutely cast that spell out into vet med, because the power that comes with that would be incredible.
I would add on to that. I love that we can kind of create this picture together. I would add on to that really a systems focused approach. So, that's whether it's the the me, we, us, of positive psychology, or just having a system that supports, and from my perspective, education, well-being in veterinary education, whether it's for future DVMs, technicians, assistants, having that support at the systems level, so that it is also at the faculty and staff level, the student level, that I have seen that work and be something so beautiful. And it even turns folks who've had really traumatic work experiences, aka complete lack of psychological safety. I've seen it turn it around, and I've seen those people flourish, which is the goal for you know for all in veterinary medicine, including our four-legged and two-legged and furry, etc. friends.
Thank you, Cody.
Yeah, I feel like I kind of echo. I think kind of, what I jotted down is my magic wand would be everybody fostering that this is a career, not a job. I think that vet med historically has done a poor job of that mentality. I kind of reflect on my career and kind of where I got to where I was at. I was 6 years in industry before I knew what a credential technician was, another 8 years before I knew what a VTS was. It wasn't until I joined VHMA, in 2018 that I knew what a CVPM was, right? So when I entered the field, when I was 16, if you wanted to be successful in vet med, you had to be a veterinarian, and I think that there's obviously other career paths within our field. So I think for me, and I think it kind of ties into a lot of the stuff that we're talking about, is just fostering this idea that we all have our roles. These are careers and not just jobs.
I love all of that. And for a sake of my daughter and I have started watching Harry Potter again, and so we went to Universal, and I have my I had to pull out the Sirius Black one. But the thing that I think about is, like, when I was my first like few months in recovery, I remember somebody telling me, like, we can't give away what we don't have. And just as leaders and as individuals and connecting with other people and being able to show empathy towards another human being, is I have to be able to be compassionate with myself. And so, just a huge, huge proponent of, I know everyone in here is, but the impact of self-criticism, the power of self-compassion, and the way that reflects on all of the things that we do, how we communicate with one another, how as a leader, if I'm able to practice self-compassion, I'm able to sit down with another human being and give feedback and do these things and understand how my words are going to land. If I have a client going through this, and it's just, and what we found, and one of the tool that we have is one of the biggest drivers of burnout. And there was just a study that was published, the flip side of this, but correlates with our data, is self-criticism is one of the biggest drivers of burnout. And here it is, like I'm thinking, again, all the systemic issues, and which still are big, but the stories that we tell ourselves just cook us. They have the power to just cook us. And so that energy, and so that too is like, if we could talk to our friends like Ted Lasso, be curious, not judgmental, believe. I know everybody in here is a fan of that show as well. But if we could just talk to ourselves in that same voice, like the impact that ripple effect that would have. We're almost coming up on time, so I want to end on this note that I think I'm just excited, and I think this is going to bring out the joy in all of us. Is what gives you hope right now? That realistic optimism, like everybody in here, I think we all err on the side of an optimistic thinking style. But what is it that gives you hope, other than my cockatoo screaming right now, which is joyous, because I didn't like birds until 2022, and that brings me hope that I can change my mind about things. But seriously,
there are so many things that give me hope when it comes to vet med. And again, we could talk about that for another hour. One thing that's really exciting for me in doing what I do is the focus that is being put on human thriving, and the focus in like a scientifically backed way, right? We have studies out there that are looking at what drives well-being in veterinary technicians in vet med. It's a fabulous study. It came out just recently, and I highly recommend everybody check it out. And it's vet tech specific, and it asks questions like, what's driving your well-being? What's contributing to your burnout? Why are you thinking about leaving the profession? What would help you stay? Science like that. Because truth of the matter is, we're all humans, right? Yes, we're veterinary professionals. Yes, we have that little crazy gene going on in our brain, but we're all human. And I love that, because we all are going through this experience together in this way that nobody knows what they're doing, and we all get to figure it out. And whether we're a veterinary professional, whether we're at home with our family, whether we're at work, whether we're talking to clients, whether we're talking to students, we're all still human. And so that realization, right, that sort of welcoming of, yes, we are veterinary professionals, but we're also human. And we have this brain in our head that does these things, like tells us stories and makes us think that, we can't do something, or maybe we shouldn't do something. And it gets the chatter going. And then we have this mindset that goes with that. And then self-fulfilling prophecy and all of those things that come with being human. The thing that gives me so much hope about that is the support that we're getting as humans through studies and through scientifically backed research on how to boost our well-being in ways that make sense, in ways that are repeatable, in ways that we can implement that have proof, right? It's not just my opinion or my experience said. There's science behind this. And it's every day there's new papers and studies coming out. And I love that. And I think it's wonderful. And it is a beautiful source of hope for us as humans and as veterinary professionals.
Andy, you are just on fire tonight. And yes, 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 yes. The science behind thriving and flourishing is that gives me hope every day. What did Dr. Seligman say? If we treasure it, measure it. And so we need to be measuring it, and we are. We need to get the word out to people. And my hope, I think, I have hopes at the me, we, and us levels. So at the individual level, my hope comes from a place of seeing that when I model well-being the for the leadership team that I'm on, for example, I have seen them start to then the ripple effect occurs. They check in with other people about their well-being. Our faculty is implementing well-being check-ins in their courses, and so that's kind of the me and the us. And the gosh, I get so excited. There is so much hope. I will say I used to be a glass half empty, and I am a student of learned optimism. Optimism is, you know, sometimes it can be annoying to other people around me. However, I can't help but be optimistic when I'm in gratitude. And I am grateful that I can be human in this field. I can then turn around and say to my students, I managed my time poorly. This is what happened. I can apologize sincerely and show them my solution of how I'm going to do better because I value them and they matter. When I do that, wow, I get some amazing responses. So my hope is that we are making a difference. We are letting people know that they matter and they're feeling it. Cody, over to you.
Yeah.
Hopefully I'm back now.
Yes.
Okay, good. Yeah, no, great insights from the both of you. No, I think what I just wanted to highlight that there's an ever increasing number of leaders prioritizing, well-being and having these conversations. So, I'm not a big fan of like a top-down mentality, but I think when it comes to something like this, we need those leaders that are not afraid to have these conversations and to make this a priority to allow kind of that mentorship aspect to allow other people that want to be these type of leaders to have access to this knowledge, right? And I think that just sets the tone of what we want to continue, for our current teams, our future teams, and everybody in between moving forward.
Thank you, guys. This has been wonderful. I know for me, like the hope is, one that we're all having this conversation right now, like, and these conversations are being had all over the world. Getting to have these conversations with folks in Australia, in the UK, in Canada. I mean, Canada's on fire. Just all of those things, and that we're, and Andy said it, like none of us came out of the womb knowing how to, put in a central line. Like we're all humans first, that we're taught to be veterinary, to be veterinary professionals, and that we're honoring that we don't leave our humanness at the door, is that we're not automatons, we're not robots. And I just love being able to lean into the strengths of that. And, one of the things, and I'll say for me, it's not even well-being adjacent, but I love the focus on contextualized care, on spectrum. As a general practitioner, it's something very close to my heart, that, and, growing up with, with a number of animals and not a lot of financial resources, is that I personally wouldn't have, I don't know that I would have made it through, childhood if I didn't, have, and I, by the way, we did have horses too, Andy, back then, like, so, but to have ducks and horses and, and dogs and cats, and that is something that was so impactful to me, that I love when we can sit down as practitioners and just say, there's no judgment. Like I'm here basically to coach you. Like I want to help find a solution with the tools that we have that's going to give us the best solution for that. And there's no judgment. It's I want to be there for you, and for you to be able to, have that bond with, with your pet. And just realizing from a moral injury standpoint, the impact that spectrum of care and contextualized care has had, the benefit on me and a lot of my my colleagues, and a lot of us, as well. So yeah, like that, there's just a lot of beautiful things moving forward. So I just want to end and say thank you all for spending this evening with us. Very excited for everybody to get to hear your words of wisdom, your insight, the beautiful things that you're doing. We'll also have connections to so people can get in touch with you after. I think this will be placed on YouTube, and marketing agency and the FVMA are going to be getting this out into the open. And any quick closing words to everybody listening? We talked about hope, but I just want to give you guys the last word.
I always love to remind people that as a veterinary professional, you are in the best industry around. Vet med is amazing, and it's full of amazing people. And thriving in this profession is possible. And we don't have to do it all alone. We have one another, and that makes it even more possible and probably even a little bit more fun along the way.
Yeah, no, I agree. And to kind of piggyback off of that, Andy, I think find your people, right? Like, I have supported mixed animal practices, and I don't think I would have turned a technician to the Equine Technician Association. Quite frankly, I never knew it existed. So, I think that, this highlights that there's a number of organizations out there within VetMed that can be very specific to what you do on a day-to-day basis. And I think that networking and just finding your peers is super beneficial.
Rebecca.
Well, gosh, I think what I have to end with is I try not to take myself too seriously, and have fun along the way. Rule 62.
Rule
Can't
62.
Can't take myself too seriously. So I love what's been shared because it's a reminder that yes, there are challenges. There are so many more wonderful things happening than there are challenges, in my opinion.
Yep.
And but always I need to remember not to take myself too seriously.
And on that, everyone, good night, good day, good afternoon.